Hey y'all, oh my goodness, it has been a long time since I made a video. So, as always, we know how medical school goes. I am so excited to announce that I have finished all of my core rotations. So, this video is going to be a combination of how my general surgery rotation went and my OB-GYN rotation. So, let's start out with my general surgery rotation. That was 12 weeks long, and it was mainly inpatient and a little bit of outpatient as well. So I love general surgery. It was something that I knew I was going to love because that is what I wanted to apply to. I have always been between general surgery and emergency medicine, and I have really close ties and very, very special connections to both specialties, which makes it an extremely hard choice. But going into general surgery, I've always loved the organ transplant community and organ transplant in general, and a lot of it stems well back from 2009 when my mother was first diagnosed with renal failure. And ever since then, not only have I been a strong advocate for the National Kidney Foundation, but also I've been in partnership and a continued and lifelong advocate for the Indiana Donor Network. And so I was just very, very excited to get my hands on any type of surgery that I could. And I had the most amazing preceptor, attending, whatever you would like to call it. But general surgery is a whirlwind. So I'm going to take it through for the people who like surgery and how to approach rotation, and then people who just flat out don't like surgery, which is okay, and how to approach the rotation. So let's start out with, if you do not like surgery, you know you absolutely don't. I think one of the most important things, just like on any rotation, I think it's going to carry you through on every single way, is show up, do the best you can, and try hard. So one of the things that our preceptor, and I think it's going to be very applicable across the board, is if you get asked a question and you don't know it, immediately go read up on that. I cannot tell you how much I read up to date, how many times I printed an article or had it on my iPad to look up and read that topic. And again, I was interested in it, but it also just made me a better learner in general. And I carry a lot of things that I did on my general surgery rotation now kind of with me through the rest of my life, the rest of my rotations and elective rotations. So if you are showing up and you're trying, and you don't have to be the best in surgery, you don't have to take upon and scrub in on every single thing, but as long as you show effort and that you're willing to try, I think that's going to be the most valuable thing. So they're going to be long days. I know our days, I was there at the hospital from 6 o'clock and then pretty much till around 7 p.m. So it was still even a lighter version of what you would experience in real life general surgery as a resident or as an attending. But again, I think the biggest thing I took away from my group is always be willing to look up the answer and then be preemptive, right? So if you know you're doing a lap chole the next day, read up on that procedure, know where the cystic artery is, know where the bile duct is, know what Codman's triangle is, and what you want to view and kind of what complications can arise. Know the indications, know why you are doing every single thing. Why does this person need a lap chole, or why not? Why does this person need, an open inguinal hernia repair versus a laparoscopic hernia repair? So just being able to be prepped like you would, but especially on surgery, just being prepped the next day, have some sort of, basic knowledge of what is going on. For those of you who want to go into surgery, do all those things, but do it a little bit extra, read further into depth. Don't just know, your indications, but now let's see, know the complications, know, what are we going to do post-op? What are the kind of healings? What are complications? What restrictions should they be on? What does this increase their risk of down the line if there's something like that would be going on? Just really try to read more in depth. Pay attention a lot to the NCCA. It's one of those two. I'm sorry, I'm mixing them up, but it's the cancer guideline website, and you can go on there. It's free to register, and you can basically look up every single type of cancer and how they follow it. What are you going to do? What are the first steps that you look for? What are the second steps, all the way up to whether you're doing adjuvant chemotherapy, radiotherapy, whatever it may be. They have every single guideline that is absolute gold. And I really utilize that hard. I ended up presenting on what we call a tumor board within our hospital, presenting those to the residents and all of the attendings it was malignant melanoma that I had a case presentation on. So I was very, very excited to have that opportunity. And I think it arose not only because I was interested in surgery, but I also showed the fact that I was willing to show up early and read and learn as much as I could possibly in those 12 weeks. And it's absolutely exhausting, I'll give you that. But for me, I felt energy when I was in the OR, and I loved it. And some days were tough, but I knew that if I could just get into the OR, it would just make my entire day. And even helping other students, and always just, if you want to go into surgery, please don't be that student that's just so tunnel vision that you're not willing to help out your fellow students. Now, I'm not saying be their teacher. I'm not saying, take away from your learning, but there's a moment to help somebody else or help your group out so that you guys can get work done quicker, or just doing something. Just be a good, well-rounded person in all of your rotations. Just don't be that student. Just be a very good, well-rounded person. Sometimes you're going to have to grin and bear it. Other times you're going to really enjoy it. As far as the shelf exam goes, the surgery shelf is IM with GI on steroids, the indications for why you're doing things, and abdominal trauma. If you know those things, you're going to be just fine for the surgery shelf because it's really IM heavy, but just pay a lot of attention to your GI and abdominal traumas. And that's really what I got from the surgery shelf. So we're going to go over to my OB/GYN rotation. So this is right after my general surgery rotation, and I did like it. It was all right. It was one of those where I was, kind of unsure walking in if I was going to like it or not, because I've had a few people say, hey, I think you'd be a really great OB/GYN, but it wasn't on my interest board, and it's still not. But I did enjoy the rotation. We had really good preceptors as well there, and it was a little bit surgery based, so I think that's why I had some sort of interest and was able to get through the rotation. But for me, that's more wild than general surgery. The hours, I woke up one night and delivered a baby at 3 a.m. after being at the hospital from 7 a.m. to 9 p.m. and then going home and coming back. So if your rotation is like that, just hang in there. It's probably only 6 weeks, just like ours was. But I think the biggest thing, again, is everything that I suggested on the general surgery rotation. Just read up, knowing the high risk factors. So everything in OB pertaining to the shelf, a lot of the risk factors are if they had it before. So like preeclampsia, what would be the risk factor? Probably a person who's had preeclampsia in their previous pregnancy. Knowing, the abnormal bleeding, whether that's premenopausal, postmenopausal, the hemorrhages in postpartum, just kind of knowing those things for your shelf. I believe there's the big four, I'm not even gonna go through it right now. I already studied for my shelf and I probably don't remember half of it, but just go over the abnormal bleeding after birth, what's considered, I know they updated some of the guidelines, the big one is what's considered postpartum hemorrhage. I think they updated it from 500 for a C-section or 1,000 for vaginal. Now it's just all 1,000 milliliters, whether it's a vaginal or C-section birth. So just pay attention to some of those things. I know the NBMEs aren't really updated too much. They're not that nitpicky, but just be aware of those for your OB shelf. And I think just one of the biggest things, like I said, is know your abnormal bleeding, know your breast cancer screenings, and then know the complications of birth. Especially what complications are going to arise if your mother has hypertension or diabetes, comorbid conditions, sexually transmitted infections, things like that. The OB rotation, though, it was high energy. It was really fun still. We had some clinic time as well as, of course, the delivery time and doing hysterectomies and C-sections, tubal ligations. So those were really, really neat to see, and just take the opportunity to learn. If you're not an OB person like me, I think it's really cool if you get to experience your first births and your C-sections. I think it's a very special thing to see, especially as a medical student, because you might not be able to see something like that again. So I did highly enjoy just seeing life and the love in the room and seeing that be brought into the world. But now I'm currently on my elective rotation, but they threw it in with our course of family medicine. So I have 3 more weeks left of this. I will be taking my step 2 in August. So please send me all of the best that you have, because it is a crazy hectic schedule for me. I have not had a break. I'm pretty much going back to back, and then I will start my elective rotations in September. Will be application season, submitting for ERAS, submitting for residency. So I'll definitely keep you guys updated on that and my elective rotations and what's going on there, and match day. As always, if you have any questions, drop them down in the comments below. This video, I'm going to gear towards more general surgery and OB questions, but again, always feel free to reach out in the comments on anything that you might have a question about. If you're just starting rotations, if you're well into them, if you need advice, or if you're a pre-med or thinking about it, or if you haven't even started college yet, I'm always happy to answer questions. And as always, best of luck to everyone. Remember, the medical journey is different for everyone, no matter if you're going to a US school, a Caribbean school. The journey of medicine is tough for all of us. So just be respectful and be kind, and I will catch you guys later.